Dr. Preece, are you doing dentures in your office?
Yes, we do.
Okay, let me ask you, are dentures really, kind of like as bad as people sometimes say that, you can't taste your food, they always get loose and that type of stuff. And if they do get loose, can the old dentures actually be repaired? So people who have like shaky dentures in it, can they come and repair the old one, or do they simply need a new one? What's the deal there? People would want to know.
Well, that's an interesting question. It's with lots of different aspects to it. Most of the time, a well-fitting denture will stay in well, and you can chew with it. Sometimes if a person's had their dentures for many years and their mouth has changed shape or the teeth are badly worn, they would need a new denture. But a denture can be repaired sometimes simply with a reline, to have the inside of it fit the tissue now after the changes have taken place over the years. Another way to repair a denture, if you have a denture that fits fairly well but perhaps is a little bit loose on the bottom, is to have some implants placed and have the denture clip into the implants. And that's becoming a fairly well-recognized standard of care for implants, is to have a couple of implants on the bottom and then have the denture clip into it. So that's another way.
A hybrid, huh? A hybrid.
A hybrid. Yes.
So you kind of like, you only put a couple or whatever it may be implants in it, 2 or 3 or whatever it may be, and that's a lot less money, and the rest of it, you have good fitting dentures, but now they fit good because, they have a good socket to sit on, I guess.
Exactly.
Okay. All right. Mm-hmm. Now, what do you think about people who wear dentures? We talked about a couple of missing teeth, and because the tooth is missing, the root isn't in there anymore in the bone, and thus the bone somehow wants to shrink. So would a denture make your mouth shrinking, and would after 5, 10, 15 years one have that caved in, dried out tomato type of face? Would that happen with dentures, period, no matter how good they're made or not?
Yes, the bone is constantly shrinking once the teeth are removed, and the bone shrinks about 4 times faster on the bottom arch than it does on the top. But if you have a well-fitting denture, even as the years go by and your mouth changes, you start to lose some of the, we call it in dentistry, vertical dimension in your face. Perhaps you've seen somebody that's worn dentures for many years, and their chin seems to be closer to their nose than a young person with all their teeth. And that's because they've lost the vertical dimension of bone in their face, and so that they would need a new set of dentures to open them back up to where they were as they were younger, restore that part of their facial structure.
So that shrinking of the face, basically, it makes one look older, right?
Yes.
Would that be avoided with implants?
Yes. When an implant is placed, the body kind of thinks that it's a tooth, and so the bone does not shrink away around that implant area. So that would be another positive reason for an implant. Okay. Especially if the implants are placed, when you first have a denture and your teeth are extracted, if the implants are placed right at the beginning, that would prevent a lot of bone loss over the years.
Okay. All right. Now, what about a person who he needs all the tooth extracted, but he doesn't have the money to do the implant now. So he needs to go for a denture, which is obviously a fair amount cheaper. Would it be wise for that person to, so to say, save up on layaway, so that in 2, 3, maybe 5 years can put the implants in it? Would that still be fast enough, or forget it, it's all dead anyway?
Well, that's a good point. It really varies from individual to individual. I've seen people who have had their teeth extracted for a denture, and within 5 years they had almost no bone on the bottom. And I've seen other people that have had a denture for 20 to 30 years and they still have good bone. So it just, each person is different as to how fast that bone shrinks away. But if you did start to save up and got an implant or several implants within 2 or 3 or 5 years, that would certainly be better. They do have the technology nowadays. If a person doesn't have enough bone, the oral surgeons and specialists can graft bone in and basically create enough bone to put an implant in. So if you've got the time and the money, the technology's there to do almost anything nowadays.
Grafting a bone in basically means gluing bone to the bone or something like that? Just in...
Yeah, Trying to... They use sometimes they use the patient's own bone. Other times they use artificial bone. It just varies, the techniques and the position and everything. So that's what the surgeon determines.
Interesting. Where do they take the bone from the patient if they take it from him?
Sometimes they can take a bone from your chin, sometimes from other places in your mouth. I've seen it taken from the hip. Those are the most common areas to get the bone samples from.
Wow, highly interesting. Well, all right. Well, that's it about dentures, and yes, they have their value. Wonderful. Thanks a lot, Dr. Preece.